All right. Hi, everyone. So excited to be here with our guest, and I will let her introduce herself.
Hi, good afternoon. I'm Dr. Kalina Sanders. I am a board certified neurologist in Jacksonville Beach, Florida. I am in a Partners of MS Care as a practice, and I have been treating patients with multiple sclerosis for over 10 years now.
Awesome. Awesome. So, a part of our theme for this month's MS Awareness Month is take control. And a part of taking control is just knowing your information, being more educated, knowing what's going on. But I believe that a part of taking control is being a part of the change you want to see. If you want to be a part of something, if you want to see change, then you have to actively participate, be knowledgeable of what's going on, and make educated decisions. So, a part of that we thought would be great programming would be to talk about clinical trials and talk about participation, but pull the curtains back a little bit and talk about not only why that may be, because we understand, I think we're all aware that there's some medical mistrust going on, but peel back the curtains as to what it takes to be eligible to participate in clinical trials. What's that process like? Who's involved? All of the things. So let's start with asking, what is a clinical trial?
So, before I get started, I just want to thank you for inviting me to discuss such an important topic. I think that this is probably one of the biggest elephants in the room when it comes to MS in the Black community. So, educating and having our patients be made aware of the insides and outsides of clinical trial research, I think is very important. But where clinical trial research comes into play is really the basis of our knowledge about the healthcare that we provide to our patients, specifically with multiple sclerosis. So, in order for us to know what works as it relates to a treatment option or what doesn't work as it relates to risk and environmental factors that may predispose a person to multiple sclerosis, it requires our ability to study it in a controlled setting. So a clinical trial has a question that it wants to answer, the investigators want to answer, and then they to try to determine how best do we get the answer to that question. And so then they actually create the platforms and then different assessments that are necessary to answer the question. And then we try to enroll patients in order to see if we can answer that question. So a clinical trial is just simply a way to answer a medical question.
Okay. I have a question, but I'm going to run it back and make sure we discuss key terms while we're
Okay.
talking, because you mentioned a term investigator, and I was going to get to this, but since you already mentioned some of these terms, I think it's best to set the tone and say who, like, let's talk about who's involved here. So I have a few that I wrote down.
Okay.
Let's start with investigator. What role do they play?
So there are generally several different investigators that are a part of a clinical trial. There's the principal investigator, which is the main person that is responsible for all clinical trial activities. So that person is responsible for the staff that are involved in the clinical trials, other investigators in the clinical trial, and then obviously they're there to ensure that the safety of the patient is there throughout the clinical trial. So that investigator may be a clinician or your neurologist, or they may be primarily a researcher where they don't see patients in the clinic, but they're still very invested in learning and answering those questions as it relates to multiple sclerosis.
Okay, so what's the difference between a clinician and a neurologist?
So a clinician is just a provider that provides care to a person. So a clinician could be a medical doctor. A clinician could also be an advanced practice nurse practitioner or a physician assistant. So it's a person that provides care to a person. Now, a medical doctor or a nurse practitioner or a physician may specialize specifically in the neurological system. So, a physician or a medical doctor that specializes in multiple sclerosis will most likely be a neurologist. but we're all clinicians in the care that we provide to patients.
Okay. So then if I am a patient and I am participating in this clinical trial, I'm a trial participant?
Correct. So a person that chooses to participate in a clinical trial, once they have been informed of the risks and benefits of participating in the clinical trial, they sign something called an informed consent that allows us to have that person participate in the clinical trial. Once a person has signed the informed consent and gone through that process, they are now a clinical trial participant.
Okay. And pardon me if I keep looking down. As you know, my little one's right here. So
Yeah,
I'm
no worries.
a mom too. Okay. So that was great because I wasn't all the way sure what the investigator's role is. And then clinician, naturally, I'm assuming that most medical care providers would fall under that name. But then I'm like, I'm not really sure in this situation. So I'm glad we cleared that up.
Definitely.
So, okay, with considering we are ill, our focus is on Black women that live with MS and or are affected by MS. And considering Black women are at a higher risk, to be diagnosed with MS, why is there a need for this conversation as it relates like to Black women, clinical trials, Black women, clinical trials?
Definitely. I think what is important for us to understand is how MS affects Black women. We need to understand why a Black female has a higher likelihood of being diagnosed with multiple sclerosis compared to their Caucasian counterparts, how our medications impact the disease process, particularly in the Black female population. And it's important for us to know this because we assume that our medications, we assume that our knowledge about MS is generalizable to the whole population, but it may not be. So when we look at clinical trials, specifically those ones that involved treatments for multiple sclerosis, we see that a very small percentage of patients enrolled in the clinical trial or clinical trial participants are actually African Americans. And, although African Americans make up 12 to 13% of the US population, Black patients account for just 5% of all clinical trials on average. And then when we look specifically at MS treatment trials, it's way less. So for example, the trial that looked at the approval for Mazen only had 0.6%. That's 0.6% Blacks enrolled in their clinical trials. And that is what we see across the board. We assume, or we're making the assumption that the effects that these medications have on this MS population that it's enrolled in the clinical trial will be the same across ethnic groups. But there may be physiological, there may be genetic differences in how these medications are metabolized within our systems that may make it less effective or possibly just as effective as in other ethnic and racial groups. So I think it's important for African American females to be participatory, let me change that word, participatory in clinical trial research so that we know for sure that our medications are effective for Black females.
She's got a question. So that was great. And I'm really shocked but not surprised at that number. But as it relates to the high percentage of, Black women that do and can be diagnosed with MS, you would want that number to be much higher, right?
Exactly.
So, okay, so that leads me to the elephant in the room, which we don't have to dive into because I think that we do all know the apprehension from the Black community when it comes to participating in clinical trials. So we know that's a thing, but I sometimes feel as a patient and someone who's working in the space, like we there's valid reasons to be apprehensive. But like I mentioned in the beginning, I believe in being the change you want to see. So how, like, can we talk about the apprehension from the Black community or bias that comes from different sides of it?
Oh, definitely. I mean, you've already alluded to some of the distrust that is there. And we know that there is historical experiences like the Tuskegee syphilis experiment and the story of Henrietta Lacks that really have shaped our current day biases. And as you mentioned, we don't have to go into the details of that because we know that it exists, but it definitely has a bias or plays a role in our current behaviors, our current thought processes about things. And there was actually a recent study that was done by the MS Minority Research Engagement Partnership Network, and they actually did a survey and looked at the perceptions and the preferences regarding MS research among racial and ethnic groups. And in this survey, African American participants were less likely to agree that the medical research has actually led to better MS treatments. So there may be a lack of knowledge of really what the role of our medications have currently for our patients with multiple sclerosis. African American participants were more likely to be more concerned that their personal information would be released without their approval, or that they would be used or taken advantage of the research team. Now, this was a research paper that was published in 2021. So we still, to this day, have the influence of past experiences within the Black community that shape our current thought processes about clinical trial research and our role in it. I hope that answered that question for you.
No, it really did. It really did. It was a good answer. It's sometimes when I'm listening to this type of dialogue, I'm like just shaking my head, but also rubbing my fingers together because I just feel like it's so juicy, but juicy in a way like we need to unpack this, like who do we talk to? Who do we call? Do we call Oprah? Like who do we call to have this very, like, I don't even know what the change could be, but everything you're saying sounds like my grandmother, my grandfather. Like, you mentioned that we say his name on Facebook. He's like, what? On the internet? For everybody to see? We're like, they know your name. Like, like there's nothing's gonna happen. And it just reminds me of, I'm not surprised that they, feel that they would be taken advantage of, and it's like PTSD. So I get it. I get it. I get it. So now that we've got juicy, I feel like we got warmed up. I want to talk about access. From my understanding, I mean, I'm nobody, but I have never been asked to participate in a clinical trial, like from my doctor or anything like that. I'm aware and I am privileged to be working in the space. So I'm understanding of, maybe where they would be or where I could find, where to get access to participating. But if I'm a general person, and I don't have all the resources, how do I get access to providers who participate in clinical trials enough for me to know, to tell me?
Victoria, I think that's one of the main issues from a provider standpoint of having the resources available for patients to have access to clinical trial research. So oftentimes clinical trial research is done in an academic center. So these are facilities that are associated with medical schools. And so oftentimes these are located in areas that are far away from the community, right? From where African Americans live. And so having access to those clinical trials is on our part is part of our responsibility for participation in clinical trial research. And so one of the things that we need to do is to have the access to research inside of the community. There are many different socioeconomic issues that come into play in a person's ability to participate in clinical trial research. it takes time. So there's the costs and there's the travel demands that are associated with clinical trial participation. It's oftentimes involves multiple assessments at different locations on different days. Like I have a patient that's in a clinical trial now that has 3 appointments this week for assessments, for testing, and for treatment. And luckily, she's a teacher and she's on spring break and she has the transportation to actually get to where these assessments are. But you can think about in our African American communities where there is a lack of access to transportation. Maybe the clinical trial site is beyond the public transportation routes. And so they don't have the physical capabilities of actually getting to the actual building of it. So I think it is on clinical trial investigators when they're selecting sites for their trials is to have them in areas that are convenient to reach the people where they are. Another part of access really involves health literacy. And so health literacy is really defined as the degree to which individuals have the capacity to process and understand basic health information. And that is needed to make the appropriate health decisions. So access is key, but we have to understand how do we get that access. So you mentioned that you have the resources, you have the knowledge somewhat to be proactive and to advocate for yourself and to reach out and find those resources and those opportunities. But for a person that possibly has low health literacy, where they don't even quite understand how to maneuver around the healthcare system, how do they even go beyond their basic healthcare needs and engage in conversations or discussions with their providers about clinical trial participation? That takes an extra level of health literacy to even want to think about it. So I think, again, it's on the researchers, it's on the investigators or the clinicians to reach to that person to say, these opportunities are available for you, and this is how we can get you access to it. But I also applaud like your platform, the We Are Ill website that is starting to have those conversations, right? Is starting to bridge the gap between the lay patient and the healthcare provider by having such discussions like this so that the lay person who's scrolling through your website, who's watching this interview and saying, oh, I never thought about that. Let me go and talk to my healthcare provider about what opportunities are available for me.
Love that. Okay, so I have a few things, and I hope I remember what I'm going to say, what I wanted to say. Okay, but when it comes to access, right? So, from my understanding, or if I'm hearing you correctly, a clinician or your neurologist, a patient's neurologist, would know about a clinical trial or may know about a clinical trial.
Correct. So your healthcare provider, your clinician may be an investigator, or they may know someone else who is investigating a certain question or a certain treatment option for multiple sclerosis. So if they are not have they don't have personal awareness of the clinical trials, they could possibly direct you to other places where you can gain that information. I oftentimes refer my patients to clinicaltrials.gov. It's a government-based website that lists all of the clinical trials that are in development or ongoing or recently completed. And you can go onto that website. There's a search bar, you can put in your diagnosis. So let's say multiple sclerosis, and you can also filter it by location, United States, the state that you're in, the city that you're in, and it will pull up all of the clinical trials that have been registered with the government in your area. And you can use that. There's contact information on that website. You can personally reach out to those individual sites to see if maybe you might be a candidate for a clinical trial they're doing.
So I also want to set the bar tone. I don't know, if like not ownership, because I think everyone and all of us are responsible here. But I guess for those who are watching, is this
Mhm.
something that they should be expect to be more proactive about? They should seek out more than they should expect to be sought out, if that makes sense. Like, should they sit around and expect that their doctor will some point ask them, or should they be more proactive and be seeking this type of stuff out?
They definitely have to be proactive in seeking out this information. We talked about some biases and influences on the patient side, but there is also implicit bias within the clinicians and the investigators. So remember, everyone's behaviors and actions are in some way based on our past experiences and our own ideologies. So therefore, clinicians may be less likely to ask African American to participate in clinical trials because they also know that there is a hesitancy within this community. So your clinician, although may be aware of clinical trials, may be less likely to approach you in this thought process that you probably won't participate, or you may not be completely a candidate for a clinical trial, and so they're less likely to ask. Therefore, you have to be proactive. You have to ask the question to your clinician, your neurologist: are you aware, or are you participating in any clinical trials that I personally may be a candidate for?
I'm glad we got back to this, because we talked about the bias or apprehension from the Black community, but
Mhm.
I definitely wanted to make sure that we did discuss the bias from others involved as well, but not, a bias in a way, and I want to say this because I think that when we talk about things that involve race, there's sometimes this assumption that it's intentional, like, and it's like, I love that you mentioned specifically, like, if I'm a healthcare provider, I kind of already know there's some apprehension from you, and we're all human here. So what does that do? How does that affect the healthcare provider in their proactivity and asking about clinical trial participation? I just think that there's just so much going on with every party involved. It's like, it's important to bring it up, because I can't even imagine in 2022 being a clinician or healthcare provider that is not Black,
Mhm.
talking to a Black person, trying to convince them to participate in a clinical trial, and just being met with apprehension and probably more.
Correct. And it's implicit, as you're kind of really alluding to. I don't think there is an intentional quest to not have African Americans participate in the clinical trial. And quite honestly, it's the opposite, right? So the push now is to increase diversity across the scope of the world, right? Including clinical trial research. And so that bias exists, not consciously, not, the providers like, I'm withholding this information because I don't want you to have it, but our experiences shape our decisions. Our experiences shape our behavior, and that is unfortunately part of it, which is why I think it's wonderful we're having this conversation to bring this out to the surface.
Yeah. So it just makes me think about so many things. So okay, when it comes to access, what it made me think of, and this is maybe more of a statement than a question or anything, but you mentioned like transportation, and I'm thinking childcare. If I have to do 3 appointments in a week, not only do I have to have the privilege of being able to use what PTO days, or just being off, or being having the days to take off, but then I have to get transportation, and then if I do have my little one, I need childcare. And I'm just thinking all of these things that probably get in the way of participating in clinical trials, because it's not necessarily right next door to you, or it's not a 1 day, 1 hour thing either.
Correct. And depending on the extent of the clinical trial, you're talking up to 2 years worth of assessments and treatments and clinical visits. And so it has a huge impact on those socioeconomic factors, including childcare. But I think some of the researchers are beginning to understand that. And thinking back at that survey that I talked about earlier, one of the things that was brought out in that survey is that the African American participants that participated in that survey were actually more likely to want or feel the need for incentives of participating in clinical trials. And that's not necessarily a negative thing, but really what they're looking for is ways in which they can help mitigate some of those socioeconomic issues that come on. So oftentimes clinical trials now are providing resources and funding for travel. So patients are being reimbursed for their gas, or they're given a stipend that helps to combat some of the loss of wages, some of the other financial impact that participating in clinical trial research may have.
Okay, I love that. I love that. And I think that makes sense. Like loss of wages makes sense. And I mean, I'm just really thinking about PTO days. Like it's just not easy like that, especially if it's potentially a 2-year commitment and you want to see it through. So I can understand how an incentive could be helpful for that. Okay. So I want to talk about, I know you mentioned a website that people could visit to see if there are clinical trials available. If there is not a clinical trial available, then what? How do you help? How do you become involved if there is not one available?
So I will say there are a number of different ways to get involved. Again, those clinical trials that are on that specific website are oftentimes very large clinical trials, but there may be healthcare providers in your community that are doing small scale surveys and small scale activities. And so it's still important to reach out to your healthcare provider just in case they may know. But I will also like to highlight specifically a registry that was recently created. It's called the National African Americans with MS Registry, or NAAMSR, which is a registry that is hoping to accurately estimate the number and geographic distribution of African American people diagnosed with MS in the United States. They're hoping to look to see the existence of barriers to access to care that we've already talked about, and then looking for strategies that are needed to undo inequities in this access. And so this is something that a website that you can go to, sign up for. They will send out various surveys where you can send back and provide your input. That's a great way to specifically target the African American population and Black women as well to get that information.
Could you repeat that website again?
Yep. It's the National African Americans with MS Registry, NAAMSR.org.
I'm writing it down myself. Okay.
It's a great website. Again, there are a lot of survey sites within MS where they're trying to glean information about multiple sclerosis in general. And it's great to have one that is specifically targeting African Americans.
Okay. So before we wrap up, I want to just bring it home, repeat some things, ask some things, hone in on some things. And I think I try to address things in a way that really hit the nail on the head for the audience. And I guess, and not my question, but I think a question would be, what is the benefit of a Black woman living with MS? What's the benefit of her participating in clinical trials, considering all of the things that have happened in history?
The benefit is that we know. Okay, the benefit is that we are now definitively knowledgeable about the impact of multiple sclerosis in this community. The information that we have available sounds devastating. there's the thought that MS is more severe in patients who are African Americans, that MS affects patients who are African American more with more devastation. And so it's thought that African American patients who are with MS are admitted to nursing homes 6 years earlier than their Caucasian counterparts. And our knowledge of how MS affects African Americans and Black women is from very small retrospective studies. So the largest study that was looking at how MS affects different races and able to pull out information about African Americans has about 600 patients in it. So the information that we have currently is all based on a limited number of patients. And so if African American women are actually participatory in clinical trial research, then we'll have larger numbers to glean more valuable information about multiple sclerosis. If African American females are participating in the clinical trials for drug development, we definitively know how our medications impact African American females. And so it is really helps to expand the knowledge. And then obviously that helps us on a day-to-day basis to make recommendations to guide you through your journey with multiple sclerosis.
I love that. So essentially, this all comes back to us with us participating. It comes back to us. We want, and I preach this, and I try not to say preach, but I preach this all the time. Our community, the reason why we've gathered so quickly, so large a number, and so I guess empathetically, is because we all felt unseen, unheard, and not that we weren't part of the narrative. And the irony of it is that we have to actually do something as well to be included. And I like having conversations like this because it really pulls back the curtains on what that looks like and how things work. We can't make up how things work. Things work in a way, clinical trials work in a certain way. How information is released, articles are written based off of information. And if there's no participation, there's limited information to be included. So I try to talk about that all the time. So this is such an amazing conversation. And we're so happy to have you explain these things to us because it's so necessary. It's so necessary.
Victoria, I will put in a plug for STEM. And I know you have young African American females that are listening to these interviews and these conversations. And so these are potential people that can make change, not beyond just participating in clinical trials, but being investigators in clinical trials. I think there's a huge need for diversity of investigators. People often respond differently and more positive to people who look like them. So many times the Black community is being asked to participate in clinical trials by white males. But if we had more Black females in the science and the medical field that are actually being the investigators, being the study staff to help reach and bridge that gap, I think is just as equally as important as patients participating in the clinical trial. So we have to not only build up from the bottom, but we also have to be at the top. And we have to make sure that clinical trial designs are inclusive of patients, that when we think about how clinical trials are developed and designed, that the African American female is in the minds of those developers, those investigators that are designing these clinical trials. Many times clinical trials may have inclusion or exclusion criteria that not purposefully targeting or preventing the enrollment of persons of color, but inadvertently does. So there are sometimes exclusion criteria that may be weight-based, or there may be exclusion criteria that involve comorbid conditions that are oftentimes more likely in the African American female, such as diabetes, high blood pressure, high cholesterol, can sometimes be exclusion from participating in clinical trials. So we need Black women at the table, right? They need to be in the room where it happens, so that when clinical trial design is happening, the African American female is in the mindset of those developers.
Wow. The design. Oh, wow. I like the clinical trial development part. I wanted to talk about that and I forgot to talk about that. And I'm so glad you brought it back home and brought that up because I think that's a part of, well, I know that's a part of what I wanted to talk about this for. Like when I learned about some of the requirements or eligibility factors, it blew my mind because I wasn't even thinking about that. Sorry, I wasn't even thinking about that. I was only thinking about the numbers, like participation, getting participants, but I wasn't really thinking about, okay, there may be factors that would exclude Black women or the Black community from even being eligible, even if they were interested. So I'm glad you said that. And that's just so powerful. And I'm definitely with We Are Ill. We have a lot of plans and we definitely are trying to attack things from every corner. So I love that you mentioned girls in STEM and the need for it and the need for or the desire for Black faces to be the clinician or person asking you to be a part of this. I fully understand that. And we want to be a part of whatever that is to encourage that and increase that number. So thank you for mentioning that.
Oh, definitely.
Okay. So I won't ask for your social media, but where are you based? I know that we are very interested in creating somewhat of a directory of where our community members can find Black neurologists. So maybe somebody will move to your town to see you. So where are you located? What city?
I am in Jacksonville, Florida. I specifically practice in Jacksonville Beach, Florida with Baptist Neurology. So if you are in Jacksonville, you'll know Baptist, and I'm at our Beaches location.
Okay, awesome. Well, I think we covered it all. I'm sure there's way more to talk about, and we could talk about this for hours. Just like in our initial conversation, we could just chat it up about it. But we'll wrap this up, and I want to thank our sponsors, Biogen, for supporting this important conversation. And I want to thank you for being here and just explaining and just taking the time, because I know you're busy, but taking the time to really educate us and explain to us what's going on and why this is such an important conversation to have.
Awesome. Thank you for inviting me to participate. I thoroughly enjoyed this conversation.
All right. Thank you.